So I want to talk to you about the Diencephalic Syndrome, which is a very strange syndrome. As you know, the diencephalon is composed of the epithalamus, the thalamus, and the hypothalamus, and the adjacent third ventricular structures. And so if you have Diencephalic Syndrome, the patients often are children who are emaciated and very thin, and they present as failure to thrive. So it might mimic a GI thing because they might have nausea, vomiting, weight loss, and they're not gaining weight in an appropriate way. And they might go to GI, for example, and get a full gastrointestinal workup, and there's nothing wrong with their GI symptoms. Systems, and then you might be tempted to say maybe the mom isn't feeding the kid, or blame the mom or the dad in some way, child abuse or Munchausen by proxy, or factitious disorder imposed upon another person, all sorts of DSM-5 diagnoses, when this is really a problem from the hypothalamus. So as you know, your hypothalamus is intimately involved in your appetite and your control of metabolism. And so patients who have a mass lesion in the hypothalamus can present as a weight loss, failure to thrive, emaciated kid with nausea and vomiting with a negative GI workup. And so the role of the eye doctor here is to look for the chiasmal involvement from the adjacent hypothalamic lesion. And so we're going to be looking for optic atrophy, diplopia, and nystagmus. So a kid who has the diencephalic syndrome with eye problem, you should image that with an MRI with attention to the optic nerve and chiasm. And the most common lesion in a kid in this location is a glioma. And even though usually it's juvenile pilocytic astrocytoma, which is a very low-grade glioma, higher-grade gliomas and other newer gliomas like the pilomyxoid glioma can occur in the exact same location. And so it's really important that you recognize this diencephalic syndrome, which is an intracranial cause of failure to thrive.